Stroke. Most of the time we found people experiencing sudden numbness, sudden trouble speaking, sudden trouble seeing, sudden trouble walking, and sudden severe headache. These are the 5 warning signs of stroke. Thus, an individual may experience a mild stroke without realizing it, and a mild stroke can be an indicator that a more serious stroke is on its way. So it is high time for us to keep a clear conception about stroke. Synonym: apoplexy comes from the Greek word apoplexia, which means seizure, in sense of being struck down. Stroke is a cardiovascular disease, causes both physical and mental crippling. Crippling refers to unable to walk or move properly. Definition: World Health Organization defined stroke as rapidly developed clinical signs of focal disturbance of cerebral function, lasting more than 24 hours or leading to death, with no apparent cause other than vascular origin. Types of stroke. There are 3 main types of stroke: ischemic stroke, hemorrhagic stroke, transient ischemic attack. Ischemic stroke occurs due to clot formation when a blood vessel supplying blood to the brain is obstructed, like in case of lacunar infarct, carotid circulation obstruction, vertebrobasilar obstruction. Hemorrhagic stroke occurs when a weakened blood vessel ruptures and causes internal bleeding, like in case of spontaneous intracerebral hemorrhage, subarachnoid hemorrhage, intracranial aneurysm, arteriovenous malformation. There is another type of stroke which is known as transient ischemic attack, caused by serious temporary clot formation due to microemboli, a warning sign of stroke or mini-stroke. These are episodes of focal reversible neurological deficit of sudden onset, less than 24 hours. That's what people experience more before having a stroke. Without realizing it, this kind of attack goes silently, but they may destroy a part of brain by producing interruption in blood flow. The impact of your stroke depends on the area of the brain involved and the amount of tissue damaged. If your stroke affected the right side of your brain, your movement and sensation on the left side of your body may be affected. If your stroke damaged the brain tissue on the left side of your brain, your right side will be affected. How do stroke happen? 3 morphological abnormalities such as stenosis, occlusion or rupture of arteries resist blood flow towards the brain, and then brain cells damage due to deficiency of oxygen and nutrients. Risk factors: hypertension, which is the leading cause of stroke. Cardiac abnormalities like atrial fibrillation, valvular heart disease, left ventricular hypertrophy, cardiac dilatation. Diabetes mellitus, elevated blood lipids, obesity, smoking, glucose intolerance, blood clotting and viscosity, oral contraceptives, infections that cause inflammation such as lupus or rheumatoid arthritis. Prevention of stroke: control of arterial hypertension, early detection and treatment of transient ischemic attack, control of diabetes mellitus, elimination of smoking, prevention and management of other risk factors, education and training of health personnel and of the public. Unhealthy diet trigger stroke, like muffins, donuts, chips, crackers, which are baked trans fat. But a healthy diet prevents stroke, such as fruits and vegetables, fish, whole grains, low-fat dairy, water helps to thin the blood, which in turn makes it less likely to form clots. How can we diagnose a stroke patient at home? 1. Ask the patient to smile. 2. Ask the patient to raise both arms. 3. Ask the patient to repeat a simple sentence with you. These are 3 simple ways to diagnose an individual is having a stroke. Some tests are done to confirm a stroke. CT scan, MRI, Carotid Ultrasound, Transcranial Doppler TCD Ultrasound, EEG, ECG or EKG. Treatment of a stroke patient. Intravenous injection of recombinant tissue plasminogen activator, also called Activase, is the gold standard treatment for ischemic stroke, usually given through a vein in the arm with the last 3 hours. Carotid endarterectomy, angioplasty and stents. Emergency measures: drug to lower blood pressure in your brain, surgery to remove the blood and relieve pressure on your brain. Rehabilitation. Cerebrovascular disease, stroke, is the leading cause of disability in adults, and each year millions of stroke survivors have to adapt life with restriction in activities of daily living as a consequence of stroke. Many surviving stroke patients will often depend on other people's continuous support to live. Stroke patients are at high risk of death in the first weeks after the event, and between 20 to 50% die within first month depending on type, severity, age, comorbidity and effectiveness of treatment of complications. Patients who survive may be left with no disability or with mild, moderate or severe disability. Considerable spontaneous recovery occurs up to about 6 months. How do you treat a stroke at home? By providing personal care such as bathing and dressing, coordinate healthcare needs including medications and doctor and rehab appointment. By managing finances and insurance coverage. By helping the survivor maintain and increase his or her ability to function. By involving social worker or case manager, psychologist or psychiatrist, recreational therapist, occupational therapist, physical therapist, and dietitian, we can improve the condition of a stroke patient.